I'm Dr. Sharvari Mundhe, gynecologist. I specialize in reproductive medicine and IVF, and I'm associated with Motherhood Group of Hospital, Sarjapur branch, Bangalore. And today we are going to speak about embryo transfer. So embryo transfer is the last and the most crucial step in IVF, wherein we start preparing the endometrium, that is the lining of the uterus of the female, by giving her hormone medicines, and once it is satisfactory, we transfer the embryos that are selected by me and by the embryologist back into the uterus by the means of a thin catheter, and it is done under ultrasound guidance. So embryo transfer is a very complex procedure. So we have to start medication for preparing the lining of the uterus, and we try to mimic the normal menstrual cycle. And once the lining of the uterus is satisfactory based upon the blood flow and the thickness that we monitor on ultrasound, we start progesterone in the second part. First part, the medicines are estrogen. Second part is progesterone. And after starting progesterone, we calculate whether it is a day 3 embryo or day 5 embryo, and then we schedule the transfer accordingly. So basically we can go for multiple embryo transfer when there is 1 or 2 embryos which are good to moderate quality, or if the lining of the uterus is not good, if the patient has had previous failed IVFs. And single embryo transfer we usually prefer in patients who have come to us for a second pregnancy, or who have underlying conditions like hypertension or diabetes, or any uterine abnormalities, where we don't want to put an extra risk of multiple pregnancy in the female who already has some underlying problem. So basically the main and important role for the patient is to be calm and be stress free. Take the medication that is advised on proper time as per suggested by your doctor, and follow a balanced diet and exercise whatever is being recommended by the doctor. So basically it depends whether we have any surplus embryos in store or whether we need to go for another IVF. It depends upon whether the quality of the embryo was good or not, or there was any problem in the lining of the uterus. Accordingly, the doctor will chalk out a different plan for you in the next IVF or the next embryo transfer.